Hi, everyone, and thank you for Public Health live Q&A session for our Global Health Graduate Program. My name is Megan Mingy. I work on our admissions team here for the online programs for applied learning. And with me today, I have our program director, Bill Brieger, as well as Cristina Salazer. So Bill, if you'd like to introduce yourself, and then Cristina, you can do the same.
Okay, yeah, I'm Bill Brieger. I'm directing both the Masters in the Community-Based Primary Healthcare, as well as the Global Health Planning and Management, and the Certificate in Global Health. These are based on courses that we, have been working on and our experience over the years. And for my own courses, my own teaching, I pulled in my experience having started in global health in 1976, working in Nigeria at the University of Ibadan. I was there for 26 years, but did consulting throughout Africa and different countries on child survival, neglected tropical diseases, training village health workers, that type of thing. So I've been associated with Hopkins since 1989 when I got my DRPH, and then I've been was an adjunct faculty for about 10 years. Started online teaching even then when I was still based in Nigeria. I came back to the States in 2002 and have been full-time on the faculty at this Department of International Health since then. And again, my focus has always been on trying to develop online learning opportunities to reach a maximum audience for our department, because many people can't find the time or funding to come to Baltimore to take courses. So we want to make sure everything is available, to anybody who needs to learn. So I'll turn over to Cristina.
Great, thanks, Bill. My name is Cristina Salazer. I am the Academic Program Manager in the Department of International Health. My background is in biology, environmental studies, and in communications. And I've been with Hopkins for 12 years, and all 12 years with the Department of International Health, which comes to say that it's a great department to be in, and I love the work that all our faculty are doing. And I've been working with Bill on the administrative side on developing these new masters and the certificates. So welcome, everybody.
So the purpose of our session today is to allow our applicants the opportunity to just ask questions about the specific programs, curriculum, admissions, all of those details that are important to ask Cristina for their input. So we are starting to get some questions into our Q&A component here. One of the first questions, this is one that we do hear a lot from our applicants, is if you could share the difference between the two master's programs, so the Global Health Planning and Management or Community-Based Primary Health Care program. So if someone's trying to decide, what would be differentiators?
Okay, well, that's always the basic thing that we have to deal with. We had to explain the same thing to our curriculum committee at school. What we're looking for preparing people to do with the primary healthcare masters is people who will actually work at the front line, training health staff, organizing community workers, organizing communities, being at the front line in both NGOs and health agencies. We also, of course, recognize that health and development are connected, and we may get people who are more in the development area working in related fields like education and agriculture, but the whole focus is on community-based work. The planning and management masters is looking to prepare people to actually help run programs and NGOs and organizations and health departments at a higher level, whether that's at a province or a region or a state, even a national level. But the idea of bringing together the resources necessary to make programs run. Both courses have the same first year, which is our certificate in global health, and so they do both cover the basics in global and international health.
Great, thank you.
I don't know if Cristina wants to add anything.
No.
Okie doke. And it's good to see the curriculums up here on the screen.
Yeah, and one thing that I will mention as far as admissions requirements, you can apply to both master's programs simultaneously. We definitely recommend, though, of course, you'll have to choose one. If you submit applications for both, eventually you would need to make a decision there. So definitely comb through the website, read up on the curriculum, and also our admissions officer team is here to help with questions. You know, if you ask a question that would be better suited for Bill or Cristina, we would share that question with them as well. Because ultimately we want to help you make that decision as soon as possible and choose the program that's the best fit for your goals. So if you're not sure, don't hesitate to reach out.
One thing that might be able to help people think about this more clearly is, you know, what career goals do you have? Why are you seeking an additional qualification? You know, we assume that there would be a number of people applying who are already have a first degree and are already working for an NGO or working in a health agency, health ministry, health department, and they, you know, want to strengthen their professional background. This certainly helps with things like promotion and looking for new jobs. But the idea is that you may already be in a situation where, you know, you are either doing management work or you're doing frontline community work, and that would help you. If you are not yet in in either of these fields, but you've done some, in addition to your regular full-time job, have done some volunteer work. I know some of our applicants have been on various kinds of short or longer term missions overseas to provide health assistance to different communities. Some people have been working more at the community level. Some people have been managing the logistics for these kinds of outreach activities. So if you've been managing, you know, you might want to go into the planning and management. If you've been organizing frontline activities with communities, you may want to do the primary health care one.
And I would also like to add, for those people who are trying to decide between both of them and are not currently working in the field right now, maybe one of the options would be just applying for the certificate and then taking those courses for the certificate, because you can always apply again and choose the path, but you already have the knowledge from the courses that you would be taking on the certificate to actually decide what path or what masters to apply to. It's a little bit more administrative work because you would have to apply twice, but I mean, I don't know if the gain would be, you know, I would see it as you would actually make a better decision if you're not in this area right now. You would have a better decision doing it if you just apply for the certificate.
And definitely, you know, by the time you've gotten into the fourth term of classes for the certificate, you do have plenty of time to apply for one of the masters. So that's not a difficult decision to make. We, as you know, right now our applications go through the 10th of July. So if our academic activities for the fourth quarter end in May, you still have plenty of time to apply for a master's if you initially applied just for the certificate.
Yes, thank you. And I totally agree, that's a great option. And the application process is a little bit abbreviated for the certificate. So especially since like July 10th is our deadline to submit your application, and that's not too far away. So if you have far in the application process yet, that may be a really beneficial option for you. So I have a quick question related to the certificate, and some other questions are coming in as well. For our attendees who maybe haven't seen how to ask a question, there should be a chat box. So we had someone ask what the duration of the certificate would be.
That's a very important question because, again, it's completely online. It is designed such that if you have the time and the funding, you can take 2 courses a term and finish the certificate in 1 year and then finish the second year of the master's in 1 year if you take the required 2 courses each term. But just like our other online programs in the school, you can move at your own pace. And if you, because of work or because of funding, can only take 1 course a term, you have up to 3 years to finish the certificate and up to 4 years to finish the master's, so that you can, take it at your own pace.
Great, thank you. And we had someone ask a related question. There be a gap between getting the certificate and then pursuing the degree?
Well, there are some people who have applied for the certificate, for example, who already have a master's degree in one thing or another, but they don't have a qualification in global health or international health. And so that's one clear area where people would want to do a certificate because they have other qualifications, academic qualifications. If people have their bachelor's degree in work experience, but they want to move up professionally, then that's probably definitely why you would want to do the master's. But as Cristina said, if you are not really sure which one you want to do or how far you want to go with this, you can do it step by step. And the first step would be to complete the certificate, and the second step would then be to apply for one of the two masters.
Yeah, thank you. I think the question, the certificate this year, I started in the fall of 2018 and finish it after a year of courses. Could I take a break and then come back and still have those credits apply toward one of the MAS programs?
Let me let Cristina answer that.
Yes, so it is a bit of a complicated question or answer because it is based on when you took the first class. Because if you do the certificate and you want to get it towards a master's, you have 3 years between the first class that you take to apply it to a master's, to not just be admitted, but to enroll. Okay, so if you complete the certificate in 3 years and you want to take the off, then unfortunately those classes from those beginning classes are going to start not counting.
So sooner better than later.
Yes, exactly.
You would have, and again, if you finish earlier, then you would, if you want to take off a year. But if you spread yourself out the whole 3 years, that you're right up against the wall.
Exactly.
That's really helpful. I think once someone becomes a student, they would definitely have the opportunity to work with their student services coordinator and or the registrar on kind of the layout of their course plan. One quick thing to keep in mind, if you're a U.S. Citizen and you're looking to use federal financial aid, then you would want to make sure that you're taking 2 courses per term to be eligible for aid. So that is one thing that impacts your kind of program flow. And so along those lines, we are getting some questions about how the hours work and how tuition works per credit hour, just especially for international candidates who might not work within the same type of system. So I'm happy to answer that, or if you would like to take it, that's fine as well.
Well, why don't you start?
Okay. So our tuition for the upcoming academic year is $1,128 per credit hour. Our certificate program is 25 credits, and then each of the masters is 50 credits. Good news, every student in our programs online for these specific Masters of Applied Science and these specific certificate programs is eligible for a tuition scholarship of $433 per credit hour. So we've got a rundown of our tuition on the site, but per credit hour means that if a course, you can see here on the screen, if a course is 2 credits, then you would multiply that tuition and scholarship balance 2 hours. If it's a 4-credit course, you know, you can do the math there as well, but it totals up to either 25 or 50, depending on which program you're pursuing. All right, and then we've got more coming in. So this is one related to kind of career background and pursuits. So this is someone who's an engineer looking to develop medical device programs. So would the global health planning and management courses pertain to that type of like global medical device integration? They mentioned that might be a kind of a broad field to answer to, but any insight you have would be helpful.
Okay, well, I mean, I think as we've said earlier, the actual courses are on the screen. We do deal with some issues of procurement and supply of particularly pharmaceuticals, but we don't really get into the technical side of developing. But if you, in the process, create an NGO or whatever that is responsible for organizing and managing the distribution of those devices, then possibly that kind of a course might be helpful to you. But if you want something more technical along the lines of, you know, developing and designing medical devices, that would not be appropriate. So basically, if you are running an organization that does X, Y, or Z in the health field internationally, then the planning and management might be appropriate. But if you need more technical focus, we would not really be providing that.
Thank you. And the person who asked that question wrote in and mentioned that they are looking more for program management. So I do think there's some good relevance there.
Yeah.
And we are getting some questions around career opportunities. So can you speak to, I know it's 2 different degrees, but what kind of opportunities might be available for each?
Okay, there are 2 things. Like I said, initially, these 2 courses sort of grew out of an effort that we had in the department to develop a different kind of global health certificate. It was a much more limited course, but the idea was that it would supplement the experience and work that people who were already in the field had, so that they could then progress to a higher level. So we were not focused initially on entry-level people. That said, the important thing with any kind of field is the question of experience. And so that's why it's very important for you to emphasize in your application what kind of experience, because again, we do require that you have 2 full years of full-time work after your bachelor's degree, but then we also encourage you to share with us experience that you've had possibly in any kind of volunteer capacity that relates to this. If you haven't left the country, but you've worked with diverse population, refugees, people from different cultural backgrounds, whatever it is, try to emphasize that, because any employer who would be looking for people who could not just have a degree, but also have experience. Even in our programs at the school, for the MPH program, we require that people have 2 years practical experience in public health. For our Master of Health Science, we do not, but then their program is twice as long and involves an internship. Obviously, on the online course, we're not able to monitor an internship, but I think the thing is that you need to consider how you get experience, because again, there are many, many different NGOs and government agencies where one can sign up and do internships on your own, where one can review their job applications, whether it's management sciences for health or John Snow International. There's so many of these groups that constantly on their website have job openings. But they also, many of them do have opportunities for newer professionals to do, newly trained professionals to do internships. So I think the key issue is how to combine academics with experience. So we expect one group of people will be already working, and this would be sort of in a way on the job training that would help them advance in their existing work for an NGO or a health department. And then, for people without that kind of, that are not placed like that, to figure out how you can start looking for entry-level positions in NGOs, in health agencies. USAID has internships. Depending on what countries you're in, I'm sure that some of the aid and development agencies in other countries, whether it's Sweden or UK or whatever, possibly have internships for newly qualified professionals. So this is the kind of thing that you need to do searching for to see what is available. But obviously people can start, but you have to do a lot of searching online for the different agency websites.
Thanks,
and
Bill.
put together a good CV emphasizing your experience.
Yeah, absolutely. And we're getting tons of great questions. We only have about 7 minutes left. So if we aren't able to answer your question during this session, someone will reach out to you and follow up. So we definitely appreciate all the questions. We got a couple related to curriculum. So do we require a thesis or research paper? I think along those lines, if you could share some information about the integrative activity, that would be really helpful.
Right. The very last term or activity that you'll be doing, whenever that is, if it's the end of 2, 3, 4 years in the master's program, we do have set aside a project, as it were. Even with all of our master's students at Hopkins, they do have to do something of a project, a capstone, whatever. We're going to be designing this as much as possible to be practical, something that you can work on as either in your existing job or as a volunteer. We have such things as program evaluations where you're working, where you have working with proposal development. You can reviewing of literature related to the global health issue, like if you are trying to find out different ways of working with community education for HIV control. So there will be a variety of options of practical activities. What we try to do, particularly at the beginning of the second year, will be to have some informal seminars, online seminars, where we can bring people together to discuss these options. And so we'll start getting people to think about that, so that when they get to the term where they will be doing their practical activity, they will have a clear sense of where they're going and be able to focus their time on that.
Great, thank you. And then just a super quick question to answer. The maximum number of courses a student can take in a semester. So if you look at the curriculum slide that's up right now, you'll see that there are 1, 2, 3, and 4. That stands for the terms that we have. So to sort of follow a term 1 and 2 could go into the fall semester. Terms 3 and 4 would be a traditional spring semester. So taking those 2 classes per term is the kind of speedier model that we offer for completing the program, that courses are offered in specific terms.
Right, and there are just a couple exceptions where we have, like in the first term for the 2 master's programs, a 1-credit course. Basically, we try to make sure that we offer you at least 6 credits, and that's for those who might be getting U.S. tuition support. But basically, this is the option, and these are unfortunately the only terms that certain courses are offered. So you can take what's available, which is geared toward the ideal size of between 6 and 7 credits, or you could take less, but you really can't take more because there's only certain ones offered each term.
Yep, and I think we have time for one last question. Do we help with internships and career placement after this course?
I'm not sure of that. I mean, if you were a full-time student on campus, there is a career office. I'm not sure how that will be made available.
Sorry, it's Cristina. I can actually answer that. So we have a career office, and they are located in the school, but they are available for any kind of advising, for any kind of, if you have questions and you want workshops, like look at your interview skills, how to write a CV, and you can have all of that to them. And if you want advising, you can actually, they will do Skype calls with the students, and this is offered for all of our students. So if you are an MAS student in our department or in the school, then you can do that. Unfortunately, for certificate students, that is not available, but for master's students, yes.
Great, thank you. And I think an important item to note is the networking opportunity that presents itself with online programs. So as a matter of fact, Bill is abroad right now. He's on the call from Rwanda. So there's definitely a robust network of people working within the profession. And I think those connections with your instructors, your program director, those are really valuable for future career goals. Bill or Cristina, I don't know if you have anything to add as far as networking for the program.
So networking happens also, you also have to think about networking happens with all the faculty or the instructors, the guest instructors, and then within your cohort, because our Center for Teaching and Learning is, and this is the center that designs all of our online classes, and Bill knows so much about it because he actually created the first online class in the School of Public Health. But they're really good at active learning and active and just like group work. They manage the way of you interacting with the rest of your class. You're gonna have to do group work, maybe even group presentations. It's not online courses here are not the passive. You watch an online lecture and then you write a paper, you take an exam. No, that's not how we do it here. We actually do a lot more what we call active learning. So there's a lot of discussion, there's a lot of, there's live talks, there's all that. So you will get to know your peers. And that is an extra way of actually networking.
Yes, absolutely. So I do see that we're out of time for the session today. We definitely appreciate all of our attendee participation and the questions that you've been asking. Bill and Cristina, same to you. We're thankful that you're able to join today and share some insight with our applicants. So our application deadline is coming up on July 10th to submit your application. If you have questions before you move forward in that application process, I definitely recommend reaching out right away. So if we've got our phone number here on the screen. You can also check out our website, and there's an option to request information there, because the application process does take a little while, especially if you have coursework completed outside of the United States. There's often an evaluation component. So please don't wait. We definitely want to help you move forward. So feel free to reach out, and we really have enjoyed spending time with you today.
Thanks, everyone, for joining us.
Yes, thank you, everyone. Goodbye.
All right. Thanks. Have a great day.
Take care.